Hi, my name is Michelle Ginsberg. I'm a radiologist and I'm Director of Cardiothoracic Imaging and Vice Chair of Education at Memorial Sloan Kettering Cancer Center in New York City. RADS refers to a quality assurance tool that was designed to standardize lung cancer screening, CT reporting, and management recommendations. It's used to reduce confusion in lung cancer screening and interpretations, and also at the end to facilitate the outcome of monitoring the different subgroups. The American College of Radiology came up with this tool, and the goal is to standardize reporting. So the reports will be categorized into categories 0 through 4. 0 through would be no lung nodules, and 4 would be suspicious nodules that require some type of workup. So for example, categories 0 and 1, which are essentially negative, represent about 1% of the population that is screened. Category 2, which has a nodule, but it's unlikely to turn into a malignancy, and the probability of the nodules that fall in category 2 is less than 1%. And about 90% of individuals that are screened will fall in category 2. Category 3 represents about 5% of individuals that are screened, and the likelihood of a nodule that falls in category 3 is about 1 to 2%. And generally, those patients that have a category 3 nodule will require a repeat scan in 6 months to evaluate that nodule. And then lastly is category 4, which is actually subdivided into 4A and 4B, and also 4X. And these are nodules that have a likelihood somewhere around 15%, or those that are 4A are usually up to 15%. Those that are 4B or 4X are actually a little higher than 15%, the probability of these nodules being malignant. And this group represents about 4% of individuals that are screened. So clearly having categories is helpful, not just to the patients who see the categories that they fall in, but also for the radiologists, because they know exactly what to recommend. And then on the receiving end, the clinician, they see exactly what category it is, what that needs to be done, and can follow it. And as I mentioned, this is also very useful to monitor the subgroups for the future. So we do keep track of this data. It is something that's just generally that is recorded, so we can go back and look at what % have fallen. And it's important also for an institution to know what their % of screenings fall within a category, because there are general categories that you should sort of fall in. So if somehow radiologists that are reading nodules as maybe suspicious and have a higher rate than other groups, that may be something that would need to be looked at, for example.